Hello, it's John Kanellopoulos here from our center in Athens, Greece, the Laser Vision Ambulatory Surgery Center, Clinical Professor of Ophthalmology at NYU Medical School in New York City, New York. This is a 65-year-old gentleman who states miserable after cataract surgery. He has a Vivity EDOF lens on the right eye, which is his non-dominant eye, and a Panoptix lens in his left eye. We're seeing him here undilated. We can also appreciate that although the Vivity lens looks centered to the pupil, the Panoptix looks a little bit decentered to the pupil. And we documented his complaints on visual function with contraindicatory that we can see here that this sensitivity drops dramatically in mesopic and scotopic conditions. We like people to be with their natural lens or post-refractive surgery, post-cataract surgery within the gray area, and we recently have aimed to surpass this in contraindicatory using toric monofocal lens, the Clarion by Alcon. Why is this problem? It begins, in my opinion, the fact that his original LASIK procedure created a very asymmetric cornea. We can see here that the ablation was decentered. We can also see that the right eye has a significant epiretinal membrane. Right eye here with your epiretinal membrane, left eye is normal. So these are two strict contraindications to use EDOF lenses or multifocal lenses. And the contraindicatory really underlines this gentleman's problem. He's OS dominant. We're going to change the Vivity lens with a monofocal. I'm not sure we'll be able to fit in the capsule after a year. A toric intraocular lens, we may have to go in the sulcus with a MA lens, which is not the optimal choice, but he will be forced to do that. And if he feels, and I assume that the contraindicatory will improve drastically in that eye. The left eye is here depicted with the squares. The right eye are the rhomboids, and the circles are the average of both eyes together. We can see how awful contraindicatory is here. So we will do a monofocal in the EDOF lens of the right eye, and if it surpasses in quality and in symptomatology, the left eye remains a problem, we'll exchange the trifocal lens on the left eye as well. And we're seeing some of the post-operative difficulties. I realize that a significant number of people are very happy with EDOF and trifocal lenses, but this is an example of why I'm very skeptical in using these lenses beforehand, as I'm sure that as a whole, the ophthalmic community does not disclose clearly the problems that most of these people have with contraindicatory. For some, they don't become symptomatic. For somehow the brain adapts to these lower quality conditions, but for some it's very troublesome, and thus we're going to go back and do a procedure that's harder than original cataract surgery. Of course, I know the aim for the procedure was the best benefit for the patient, but I think we have to reconsider what the best benefit for the patient is and put a objective basis with data such as contraindicatory, wavefront maps, etc. John Kanellopoulos from our center in Athens, Greece, signing out.